Welcome to the August 1st edition of AJP-Heart and Circulatory Physiology video table of contents from the editor's desk. This week we have many exciting papers for you to peruse. So here's just a sampling. A study by Liu et al. That falls within our call for papers on sex and gender differences in cardiovascular physiology found that estrogen protects right ventricular function in a mouse model of pulmonary hypertension. Because women are more prone to pulmonary hypertension, this study points to the potential use of estrogen therapeutically in this disease state. Del Pozzi et al. Investigate the blunted cerebral arterial vasodilation in patients with postural tachycardia syndrome, or POTS. Using transcranial Doppler ultrasound and near-infrared spectroscopy while administration of exogenous sodium nitroprusside, these investigators concluded that POTS patients exhibited a reduced bioavailability of nitric oxide and thus poor cerebral vasodilation. This response may contribute to cognitive impairment in POTS patients. Included in our call for papers on cardiovascular and cerebrovascular aging, Cesar et al. Examined the effects of calorie restriction on cerebrovascular endothelial cell function in young and aged rats. Calorie restriction prevented the age-related increases in cellular and mitochondrial oxidative stress. This data-packed study also implicates a loss of NRF2 signaling with aging that is ameliorated by calorie restriction. A potential take-home message could be eat less, reduce oxidation. Finally, in a study by Bergdorf et al., the therapeutic potential of sildenafil to improve right ventricular dysfunction and fibrosis in a rodent model of right ventricular pressure overload was investigated. They found that sildenafil, given in the established phase of right ventricular dysfunction, reduced diastolic pressure and volume, improved RV ejection, and decreased fibrosis. These data lend support to the notion that this PDE5 inhibitor may be used therapeutically in established pulmonary hypertension. Thank you for joining me again for this video table of contents highlights. See you in 2 weeks, and send us your best science now.